Old age is a natural journey in life, but we don't always recognize the signs that a loved one may be nearing the end of this path. In this video, we will discuss 7 signs that indicate an elderly person may be in their final year of life. More importantly, we will explore how to act to ensure they have comfort, dignity, and love until the very end. The human body has a unique way of communicating, especially as it approaches its limits. Small details, often overlooked in daily life, can be the first warnings that something is changing irreversibly. When we observe an elderly person going through these transformations, it is natural to feel fear, anguish, and in many cases, even silent denial. No one wants to think about losing someone they love, but understanding the body's signs can help us face this reality with more serenity. Instead of waiting for the inevitable unprepared, we can use this knowledge to ensure that our loved ones have the necessary support, both physical and emotional, in their most delicate moments. Little is said about how to deal with the end of life, but understanding this process can bring more peace and less fear. However, the end of life can be a moment of deep connection, affection, and conscious farewell if we know how to interpret it with the necessary sensitivity. When we prepare for this phase, we can alleviate anxiety, both for the elderly person and for ourselves, creating a calmer and more welcoming environment where they feel loved until the very last moment. Many family members and caregivers feel guilty for not having noticed important signs earlier. Small changes in behavior, appetite, sleep, or even facial expressions can say a lot about the elderly person's condition. Some of these changes are subtle at first but intensify over time, becoming increasingly evident. Understanding what is happening does not mean anticipating the farewell, but rather valuing each moment more consciously, ensuring that the last days or months are lived with dignity and respect. Science and medicine have already mapped various patterns of decline that occur in the final years of life. Based on this information, we can identify 7 main signs that usually indicate an elderly person may be in their final year. These signs do not all appear at once, nor in the same way for everyone. In some cases, one sign may be more evident than others. In others, a combination of several may point to a more delicate condition. Each organism responds to aging in a unique way, but there are patterns that, when observed carefully, help us understand that the life cycle is coming to an end. This is not an easy topic, but it is a necessary one. Recognizing these signs is not an invitation to give up on the person, but rather a way to be present more meaningfully. It is a call to offer more care, more patience, and more love. It is a reminder that even in the most difficult moments, we can provide comfort, relief, and a peaceful environment for those who once cared for us. Now that we understand the importance of this topic, have you noticed any of these changes in someone close to you? Pay attention, because the signs can be subtle. The first one is a rarely discussed factor, but one that can significantly accelerate health decline: accelerated metabolic decline and loss of muscle mass. Sign 1. Accelerated metabolic decline and loss of muscle mass. The human body is in constant transformation throughout life. However, as age advances, changes begin to occur at a faster pace and, often, irreversibly. One of the clearest signs that an elderly person may be approaching the end of their journey is the drastic slowdown of metabolism and significant loss of muscle mass. This process, which may seem like a natural effect of aging, can actually indicate that the body is entering a stage of extreme frailty, where the capacity for recovery and regeneration is severely compromised. Losing muscle mass in old age is normal, but when it happens too quickly, it can be a warning sign. The elderly person begins to lose strength rapidly, has difficulty performing simple tasks like getting out of bed or walking short distances, and may even be at greater risk of falls. This extreme frailty is not only due to muscle loss but also a series of metabolic changes that reduce the body's efficiency in using energy. With age, metabolism slows down. The body has more difficulty processing nutrients, digestion becomes slower. Vitamin absorption decreases. Tissue regeneration no longer happens as it used to. This leads to a vicious cycle. The elderly person loses their appetite, consumes less protein and calories, which further aggravates muscle loss and reduces their energy and disposition even more. Many family members notice this change but do not understand the severity of the problem. Comments like, "He's gotten thinner," "She doesn't feel like eating anymore," or "He spends the day sitting because he no longer has the strength," are common, but may indicate that the elderly person's body is entering a state of preparation for the end. What seems like mere weakness may, in fact, be a warning that the body is progressively reducing its functioning. Another important factor is that this loss of muscle mass is also directly related to immunity. The less lean mass a person has, the lower their ability to fight infections and recover from simple illnesses like colds and flu. This explains why many elderly people who experience this metabolic decline end up developing recurrent infections and clinical conditions that seem to worsen rapidly. The body no longer has the same resistance, and any external impact can be enough to trigger a chain reaction. Family and caregivers can minimize this process in some ways, although it is inevitable in many cases. Stimuli such as physical therapy, a protein-rich diet, and adequate fluid intake can help slow this deterioration. However, when muscle loss occurs rapidly and irreversibly, it is often one of the most evident signs that the body is preparing for the end of the life cycle. This is a time when attention to comfort becomes essential. If the elderly person no longer has the strength to perform basic activities, forcing them can be more harmful than beneficial. Instead, the focus should be on providing well-being, ensuring they have a safe, welcoming, and risk-free environment where they can feel comfortable and supported by those they love. Sign 2. Diabetes and lack of blood. Sugar-controlled diabetes is one of the most common chronic diseases among the elderly, and when not properly controlled, it can significantly accelerate health decline. The human body needs balance to function correctly, and regulating blood sugar levels plays a crucial role in this process. When the body is already weakened by advanced age, uncontrolled blood sugar can trigger a series of serious complications that indicate the elderly person may be nearing the end of their journey. Many elderly people live with diabetes for years, keeping their condition under control through medication and a balanced diet. However, when the disease becomes unstable and glucose levels fluctuate extremely, this can be a worrying sign. Both hyperglycemia, high blood sugar, and hypoglycemia, very low blood sugar, can cause severe damage to the body. Chronic hyperglycemia can cause damage to blood vessels, leading to cardiovascular problems, kidney failure, and neurological damage. Hypoglycemia, on the other hand, can result in dizziness, falls, mental confusion, and even episodes of unconsciousness, putting the elderly person at immediate risk. One of the first signs that diabetes is getting out of control is unexplained weight loss. Many people associate weight loss with a sign of good health, but in elderly diabetics, it may mean that the body can no longer process glucose correctly and is breaking down its own muscles and fat for energy. This process further weakens the body, making the elderly person more vulnerable to infections and other illnesses. Another critical indicator is slow wound healing and recurrent infections. Uncontrolled diabetes impairs blood circulation and compromises the immune system, making tissue regeneration difficult. Small cuts can take weeks to heal, and simple infections can turn into serious conditions such as foot ulcers, frequent urinary tract infections, and even sepsis. This vulnerability increases the risk of fatal complications, especially when the elderly person already shows other signs of health decline. The impact of uncontrolled blood sugar also extends to brain function. Frequent episodes of hypoglycemia can cause memory lapses, mental confusion, and even symptoms similar to dementia. Many family members notice that the elderly person begins to have difficulty communicating, forgets where they are, or seems disoriented for no apparent reason. These signs are alarming because they indicate that the brain is suffering from a lack of glucose, which can result in irreversible neurological damage. For caregivers and family members, dealing with diabetes in a terminally ill elderly person can be challenging. Often, the person no longer has an interest in eating or drinking, making blood sugar regulation even more complicated. In these cases, it is essential to seek the support of healthcare professionals to ensure that the measures taken prioritize comfort and quality of life rather than strict blood sugar control at all costs. When the body is reaching its limit, the most important thing is not to follow strict medical protocols but to provide well-being. If the elderly person can no longer eat properly, forcing them can cause more suffering than benefits. Instead, the approach should focus on adapting meals to ensure minimal nutrition without causing discomfort. Uncontrolled diabetes in the elderly is a strong indicator that the body is losing its ability to self-regulate. When this happens, it is a sign that the body is entering a phase of progressive shutdown, prioritizing only essential vital functions. This process often occurs alongside other signs of decline, such as extreme fatigue, cardiovascular problems, and breathing difficulties, creating an overall picture of frailty. At this time, the presence of family members becomes even more important. Attention should be focused on the elderly person's comfort, ensuring they feel welcomed and free from suffering. Small gestures, such as a gentle touch, a calm conversation, or simply being present by their side, can make all the difference. The most important thing is to ensure that, regardless of their health condition, the person feels loved until the very last moment. However, today there are many ways to keep blood sugar levels under control, reducing the risk of diabetes and bringing more energy and vitality to the elderly. If you want to learn about one of these methods that is bringing incredible results to the elderly, see the pinned comment, Sign 3. Extreme changes in appetite and significant weight loss. One of the most evident signs that an elderly person may be in their final year of life is an extreme change in appetite and the consequent significant weight loss. Eating is a fundamental human need, but it is also a direct reflection of our health. When an elderly person begins to refuse food frequently, loses interest in meals they once enjoyed, or simply starts consuming very small amounts of food, this may indicate that their body is slowing down its functions and preparing for a final stage. Appetite is regulated by a series of biological and emotional factors. In elderly people, there is a natural reduction in metabolism, which can lead to a lower caloric need. However, when this reduction becomes extreme, accompanied by rapid weight loss, something more serious may be happening. Often, this occurs because the body can no longer process food efficiently, or because the organs responsible for digestion begin to fail. The liver, pancreas, and intestines work more slowly, and the brain may send reduced hunger signals, causing the elderly person to simply not feel like eating. Another important factor is the ability to chew and swallow. Over the years, many elderly people face difficulties chewing properly due to tooth loss or weakening of the mouth and throat muscles. This can make eating a tiring and even dangerous task, increasing the risk of choking and aspiration of food into the lungs, which can lead to serious infections like aspiration pneumonia. When eating becomes an effort or a risk, it is natural for the elderly person to avoid meals, which further accelerates their weight and energy loss. In addition to physical factors, there is also a strong emotional component. Many elderly people lose interest in eating because they no longer find pleasure in it, and this may be related to depression, grief over the loss of friends and family, or even social isolation. Food, which was once a moment of pleasure and connection, becomes just a necessity, and in some cases, not even that. When the elderly person begins to emotionally disconnect from the world around them, food refusal may be one of the first signs that they are entering a final stage of life. For family members, dealing with this change can be extremely difficult. Seeing a loved one losing weight rapidly and refusing food can create a sense of helplessness, as well as doubt about what to do. Many try to insist that the elderly person eat more, resort to nutritional supplements, or even force-feed them. But this can cause even more discomfort for the elderly person. The most important thing at this time is not the quantity of food consumed, but the well-being of the elderly person. When loss of appetite and weight reach a critical level, it is essential to ensure that meals are adapted to meet the elderly person's needs without causing suffering. Offering lighter foods, nutritious liquids, and small portions can help maintain some nutrition without forcing the body beyond its limits. However, in some cases, this food refusal may be an indication that the body is reducing its functions in preparation for the end. This is a delicate moment where the priority should be comfort and dignity. The goal should not be to prolong life at all costs, but to ensure that the elderly person's final moments are lived without suffering, surrounded by care and love. Sign 4. Cognitive decline and disconnection from reality. As the body ages, the brain also undergoes significant changes. In many cases, this process happens gradually, starting with small memory lapses and difficulties remembering names or dates. However, when cognitive decline intensifies and the elderly person begins to show evident disconnection from reality, this may be one of the clearest signs that they are nearing the end of life. The progressive loss of cognitive functions can manifest in various ways. Some elderly people begin to get lost inside their own homes, forget the faces of close family members, or have difficulty understanding simple conversations. In other cases, there are episodes of intense confusion where the elderly person may believe they are living in a past time, call deceased relatives as if they were still alive, or show constant disorientation regarding space and time. This deterioration of reality perception can be distressing both for the elderly person and their family members, who often feel helpless in the face of these changes. The brain is a highly complex organ, and when its functions begin to fail, the elderly person's interaction with the world changes. Communication may become difficult, sentences may lose meaning, and in some cases, the elderly person may stop speaking altogether. This state of disconnection can be progressive or occur suddenly depending on pre-existing health conditions. Diseases like Alzheimer's and other forms of dementia accelerate this process, but even elderly people who have not been diagnosed with such conditions may show similar signs in the final months of life. In addition to memory loss and mental confusion, another concerning factor is the change in emotional perception. Many elderly people who were once communicative and expressive begin to show an empty gaze, stop responding to emotional stimuli, and seem not to recognize their surroundings. In some cases, this disconnection may be accompanied by episodes of aggression or agitation, as if the brain is struggling to interpret a reality that no longer makes sense to it. Others may become completely apathetic, spending much of their time in a state of deep silence with no apparent reactions. It is important to remember that this decline does not occur in isolation. The brain controls essential body functions, such as breathing, heart rate, and the swallowing reflex. When it begins to fail, these processes may also be affected. Many elderly people in advanced stages of cognitive decline have difficulty swallowing food and liquids, which can lead to complications like malnutrition and aspiration pneumonia. For family members and caregivers, this is one of the most difficult signs to deal with. The feeling of losing connection with someone who is still physically present can be extremely painful. However, it is crucial to understand that this disconnection does not mean the elderly person does not feel or perceive the affection around them. Even if they cannot express it verbally or through clear gestures, the presence of family members, the touch of hands, and the soft voice of a loved one can bring comfort and security. When cognitive decline reaches this advanced stage, the most important thing is to ensure that the elderly person is in a calm and welcoming environment. Forcing interactions or trying to correct them when they are confused can cause even more anxiety. Instead, it is ideal to adapt communication and respond with patience, respecting the new reality that the elderly person's brain is experiencing. disconnection from reality often precedes the next concerning sign: increased extreme fatigue and prolonged need for sleep. When the body begins to progressively shut down its functions, the elderly person starts sleeping more and more, as if preparing for the final farewell. Sign 5. Extreme fatigue and prolonged sleep over time. It is natural for elderly people to need more rest. However, when the need for sleep becomes excessive and extreme fatigue dominates most of the day, this may be a sign that the body is entering a final stage of functioning. Many people believe that increased sleepiness is just a reflection of advanced age, but when this fatigue becomes incapacitating and the elderly person sleeps almost the entire day, it may indicate that the body is reducing its activities to conserve energy in the final moments of life. This change occurs because the body begins to slow down. Organs no longer work as efficiently, metabolism is slower, and blood circulation may be compromised. As a result, the amount of oxygen and nutrients reaching the brain and muscles decreases, making the elderly person feel exhausted even without physical exertion. Simple activities, like getting out of bed or holding a conversation, become so tiring that they prefer to keep their eyes closed most of the time. For family members, this change can be distressing. The elderly person who was once active and talkative now spends hours or even days sleeping, responding only with small gestures or monosyllabic words. This state of lethargy can occur gradually or appear suddenly, and it is often associated with reduced food and fluid intake. The body, already without the strength to process large amounts of nutrients, simply begins to shut down non-essential functions, prioritizing only basic vital processes. In addition to increased sleep, another common symptom is a lack of interest in the surrounding environment. The elderly person may show little or no reaction to visits, noises, or visual stimuli. Even when awake, they may seem distant, as if in a constant dreamlike state. This detachment from reality is a reflection of the brain's reduced functioning and decreased neurological activity. It is important to note that at this stage, forcing the elderly person to stay awake or trying to overstimulate them can cause more discomfort than benefit. The body is following its own rhythm, and the best way to offer support is to respect this need for rest. Creating a calm environment with dim lighting and soft sounds can help make this period more comfortable. Additionally, it is essential to monitor signs of pain or discomfort. Although many elderly people at this stage do not clearly report what they are feeling, changes in facial expression, labored breathing, or sudden agitation may indicate physical discomfort. The use of pillows, subtle changes in bed position, and the constant presence of a family member can bring more comfort during this time. Increased sleep and extreme fatigue are some of the most striking signs that the body is preparing for an inevitable transition. Although it is difficult for family members to witness this change, it is important to remember that this process is natural. In many cases, the elderly person is not suffering, but simply allowing their body to follow the course of life more peacefully. This state of prolonged sleepiness, however, is often accompanied by another concerning sign: breathing difficulties and frequent heart problems. When the heart and lungs begin to fail, the body faces even more difficulty staying active, making breathing irregular and heartbeats unstable. This is one of the most critical signs that the body is reaching its limit. Sign 6. Frequent heart and breathing problems. The heart and lungs are the engines of the human body, working together to ensure the circulation of oxygen and essential nutrients to every cell. When these systems begin to fail, the impact on the elderly person's quality of life is evident and, in many cases, irreversible. Frequent heart and breathing problems are among the most concerning signs that the body is entering a final stage, where vital energy is gradually depleted. Heart failure is a common condition in the elderly, characterized by the heart's inability to pump blood efficiently. This causes the body to receive less oxygen and nutrients, resulting in extreme fatigue, dizziness, and difficulty performing even the simplest activities. In advanced stages, heartbeats may become irregular, and episodes of palpitations and shortness of breath become frequent. Some elderly people report a constant feeling of heaviness in the chest, as if the heart is working under great strain to keep beating. The lungs also suffer from this decline. Often, elderly people in the terminal stage experience labored, short, and irregular breathing. This occurs because the body can no longer distribute oxygen efficiently, and fluid buildup can further impair lung function. This is particularly concerning in cases of congestive heart failure, where fluid accumulates in the lungs, making breathing increasingly difficult and painful. In many cases, the elderly person may begin to experience episodes of shortness of breath even at rest. These moments can be frightening both for them and for family members, as the sensation of suffocation is distressing. During sleep, breathing may become irregular, and long pauses between breaths are an indication that the body is gradually reducing its functions. Another common sign is the appearance of cyanosis, a bluish discoloration of the lips, fingertips, and extremities. This symptom occurs when blood circulation is compromised and oxygen is not being transported properly. Along with this, the elderly person may feel constantly cold, even in warm environments, as blood flow to the extremities decreases. For family members, seeing a loved one go through these breathing and heart difficulties can be extremely distressing. However, there are ways to minimize discomfort. The elderly person's position can be adjusted to facilitate breathing, slightly elevating the head with pillows. The use of humidifiers can help make breathing less strenuous, and the presence of a healthcare professional to assess the need for oxygen therapy may be essential to ensure greater comfort. Additionally, it is crucial to pay attention to signs of pain and suffering. In many cases, the elderly person may not be able to verbally express what they are feeling, but changes in facial expression, soft moans, or restlessness may indicate the need for more support. Doctors and palliative care teams can help alleviate these symptoms through medications and environmental adjustments. When the heart and lungs enter this stage of decline, it is a strong indication that the body is reducing its functions to conserve energy. This sign is often present in the final moments of life, becoming one of the clearest indicators that the natural cycle is coming to an end. Along with these internal changes, there are also visible signs in the skin and blood circulation. The next and final sign we will explore involves changes in the body's appearance, such as extreme pallor and bluish discoloration, indicating that circulation can no longer sustain all vital functions. Sign 7. Changes in skin and blood circulation. OE. Human body is an incredibly efficient machine, but as its vital energy depletes, visible signs begin to appear on the skin and in blood circulation. When an elderly person is in their final year of life, their circulatory system no longer functions as it used to, and blood has difficulty reaching all extremities of the body with the same intensity as before. This results in a series of physical changes that may indicate the body is in a state of progressive shutdown. One of the first signs of this process is extreme pallor. As circulation decreases, the skin loses its rosy tone and may take on a grayish or yellowish hue. This occurs because less blood is being distributed to the epidermis, as the body prioritizes vital functions in the central organs. Often, family members notice that the elderly person's face looks paler than usual, and their hands and feet are constantly cold to the touch. Another concerning indicator is the appearance of bluish or purplish discoloration on the extremities, such as the feet, hands, knees, and even around the lips. These discolorations, known as mottling, occur because circulation is slowing down and oxygen is not reaching all areas adequately. In many cases, this is one of the clearest signs that the body is entering a final stage, as it indicates that blood flow is drastically decreasing. In addition to changes in color, the texture of the skin also changes. As blood flow decreases, The skin may become thinner and more fragile, making it more susceptible to bruising and wounds. Any minor impact can result in purple spots, and the healing of these injuries becomes much slower. This happens because the immune system no longer responds as efficiently, and the body does not have enough energy to repair tissues. Another visible sign of circulatory decline is swelling in the legs and feet, known as edema. This occurs because blood can no longer return to the heart as efficiently, accumulating in the extremities. The swelling may be mild at first, but in advanced stages can become so pronounced that the elderly person has difficulty wearing shoes or even moving their feet and legs. For family members, these changes can be difficult to witness. The physical appearance of the loved one begins to transform noticeably, often evoking fear and sadness. However, it is essential to understand that these changes are a natural process of the body, a way of preparing for the final transition. The most important thing at this time is to focus on the elderly person's comfort. For those experiencing changes in circulation and skin, it is essential to maintain a warm environment as the sensation of cold becomes more intense. Gentle touches and light massages on the hands and feet can help stimulate circulation and provide emotional comfort. Additionally, ensuring the elderly person is positioned comfortably with soft clothing and no tightness can make a significant difference in their well-being. As the body prepares for the end of the life cycle, these physical changes become more evident and progressive. For loved ones, this is the time to be present, offering not only physical care but also love, kind words, and companionship. The presence of an attentive family member or caregiver can be more comforting than any medical intervention, because in the end, what truly matters is ensuring that the elderly person feels safe, loved, and at peace. Accompanying the aging process of someone we love is one of the greatest emotional challenges we can face. For many, the idea of losing a parent, grandparent, or loved one is difficult to accept, and the reality of the end of life confronts us with a vulnerability we often prefer to avoid. However, facing this phase with awareness and compassion can transform the farewell into a moment of love and respect, rather than suffering and despair. Death is a topic that society often avoids. We are taught to celebrate birth, growth, and achievements, but we rarely learn how to deal with the natural end of life. However, just like the beginning, the end is also part of every human being's journey. When we understand this, we can replace fear with acceptance and pain with gratitude for the shared moments. Caring for an elderly person in this final phase requires not only medical attention but also a human, sensitive, and welcoming approach. It is common for family members to feel guilt, thinking they could have done more, noticed the signs earlier, or tried to prolong life in some way. But the truth is that the greatest demonstration of love at this time is not in fighting the inevitable, but in ensuring that the person feels safe, comfortable, and surrounded by affection. Palliative care plays a fundamental role in this context. Often, there are no more medical treatments capable of reversing the condition of a terminally ill elderly person, but much can be done to alleviate pain, ensure comfort, and provide tranquility. Small gestures, such as holding their hand, speaking softly, respecting their wishes, and allowing them to rest without impositions, make all the difference. Touch, tone of voice, silent presence. All of this conveys a powerful message. You are not alone. It is important to remember that each person faces the end of life differently. Some elderly people speak openly about death, while others avoid the subject. Some cling to memories of the past, reminiscing about stories and happy moments, while others prefer to remain silent, immersed in their own thoughts. Regardless of how they deal with this stage, the most important thing is to respect their feelings and provide them with an environment where they can feel at peace. For family members, this is also a time of transformation. Grief begins even before the departure, but it can be transformed into farewells filled with love and gratitude. It is an anticipatory grief, which can bring sadness but also an opportunity for a conscious farewell. Saying, "I love you," expressing gratitude, recalling special moments, and offering emotional support are ways to ease this transition for both the elderly person and those left behind. Accepting the life cycle helps us make the farewell lighter. What matters is being present, showing love, and ensuring a final moment of serenity. Death does not have to be a moment of despair. It can be a moment of connection, closure with dignity, and celebration of the journey of the one who is departing. And when the final moment arrives, when breathing becomes lighter, when the gaze is lost in some distant point and the body finally rests, may the memory that remains be that of shared love. Because in the end, that is what truly matters. Not the number of days lived, but how they were filled with meaning,